The agenda for today, we'll quickly go over the objectives for today and some updates. And then the main focus today is returning to in-person KPL groups. It might not be relevant for everybody right now, but we are looking ahead and looking forward to going back to in-person meetings. The objectives: facilitators, affiliate families, and communities receive support needed. Keep up to date and stay informed with this ongoing situation of COVID-19. Learn together and from each other, including impacts on KPL and communities served. It's really important for us to get your feedback and get information from families to us, and focus on our community strengths. So the first thing I want to remind everybody is the KPL Caregiver Survey. I explained a little bit more about it last time, but I will just say that it's the caregiver survey that we do every year on papers in the groups. This year, we're gonna do part of it online. So what we ask you to do is to send those links in English, Spanish, Chinese, Somali, and Vietnamese. Send it to caregivers because it's really important for us to get those surveys back. It's very short, only 6 questions, and it's only demographic questions this time. We would love to know more about the people that we serve in this program, and it will really help us in childcare resources as we are trying to improve and develop this program, and it would really help you as an affiliate organization to know who are the people that you're reaching out to in this program. So please, here are the links to all the languages. Please send it to the caregivers. We would love to get it filled out as soon as possible. The other update, and I'm not sure if all KPL affiliates in King County know about this opportunity, but thanks to funding from King County, and unfortunately it's only relevant for King County, Childcare Resources is now distributing supplies to organizations, and through the organizations to FFN, to Family, Friends, and Neighbors in King County. There's a question, how do I get the links for the survey? It will be in the slides that we will send after this, this webinar, and also we will include it in the follow-up email, the link. So back to the supplies. This is an opportunity for organization, community-based organization, to get supplies in order for them to distribute it to their community and FFN family caregivers. This is the supply that you can get, and Zainab is coordinating it and she has more information, but if you would like to be included in this, again, it's only King County, unfortunately, please contact us at kpl@childcare.org. Thank you.
All right. So this is Kim speaking. We just wanted to take a moment before we dove into the content about returning to in-person KPL. to talk a little bit about moving forward, what we're offering as a KPL team to all of you facilitators and affiliates. So as usual, even before the pandemic happened, we were doing quarterly webinars. And so those happen every 3 months and they're an hour and a half. So those are the webinars that have more specific content that Nicole and I develop related to like early math or incorporating the outdoors into your group or so on and so on. So those are still happening, and the next one is in September. And then in addition to that, we are going to start something new, and we're calling it a KPL monthly convo. It will be the first Tuesday of every month at 1 o'clock. So same time and day as the ones we've just been doing. And this will not be a webinar with developed content, but more of like a monthly check-in to chat, share updates, continue the sense of community that has been built the past number of months, talk about the newsletter and anything that you may want to share, and also just to give you all a space to connect. So those will be 1 hour, and that will be, again, the first Tuesday of every month at 1 o'clock. So we have the quarterly webinars that have specific topics, and then we have the monthly conversations. And you'll get, just like normal, a link in an email from us on how to register for those via Zoom. Does anyone have questions about that? Okay, great. If you do at all, please let us know. And as hopefully you can participate in these monthly conversations. If you had feedback, please let us know. We want to be receptive to what you're needing. All right, so I think we're going to move along. So in this section, we're going to talk about returning back to in-person KPL. And like Savit said, this may not be specifically relevant to some of you right now, but it's something that we all want to keep in mind for the future. Child Care Resources doesn't have a strict policy on how or when to return to in-person groups. That's because each KPL group, community, county, and state has different situations and recommendation mandates currently on group sizes, group gatherings, and distancing, and so on. And so it really is up to you and your supervisor, your team, your organization, and those that you collaborate with in your community to decide and have a conversation about how does that look like when you decide to return to KPL and when does that happen. So this webinar will go over things to consider and think about and talk about as you go through that process. So our goal for today is just for all of you to leave feeling more comfortable about transitioning back to in-person KPL when it is time and you choose to do so. So some things to consider while you're thinking about this is to think about the recommendations and mandates of your county and state, and that will be different for all of us here today. To think about your organization, your employer's guidelines during this time, your capacity as a facilitator to return to in-person KPL, also the participants' needs and input, and the location of your KPL as well. Some groups are outdoors, some are indoors. Some borrow space from another community partner who may have different guidelines during this time than your organization. So there are a lot of different things to think about as you make this decision.
We're going to be meeting, I think, our team to decide what our groups are going to do going forward. I did meet a couple of times with a couple groups in July, just informally at outdoor venues and parks. I thought it went really well. I actually just as personally prefer and would prefer doing only outdoor KPL experiences this next year for a variety of reasons. Some of them being that I'm high risk and need to, basically stay out of buildings. and that it's safer in the outdoors, and we have access to lots of covered areas as well in Issaquah and Duval, where my groups are occurring. So it's my hope, in discussions with my team, that that my groups are going to operate outdoors until, you know, until, for me at least, a vaccine is developed, and and testing is done properly. So it's my thoughts.
Thank you for sharing. And I think that is something we'll talk a little bit about later, adapting activities in groups during this time, and expanding more to the outdoors is definitely a great alternative to keep people in a healthier and safer setting. Thank you for sharing that. Anyone else have any experiences they'd like to share or input?
I had some comments in the chat that Encompass is not offering summer groups and are preparing for virtual groups in September. It will be dependent on all the considerations you mentioned, and how there's no play and learn at all libraries yet, and no in-person in King County libraries at least until 2021.
Okay, yeah, and that's totally fine. It's good to start thinking about the transition back early on so you have time to prepare. So totally okay. And on the next slide, this is just a reminder as you are thinking about returning to in-person to really have some kind of plan as you move forward. Communicate with us, your supervisor, your team, to talk about what transitioning back looks like, and as you maybe go through some bumps, how you plan to navigate all those things. So just definitely have a plan in mind, and know that it may not go as planned, and that's okay. So just keep in mind really emergent curriculum during KPL about how we have to kind of go with the flow sometimes. And as we already mentioned, on the next slide, we have just a reminder about participant input. This is a community-based program, so please do keep in mind to have really solid communication between you and your participants about how they may need specific things or have concerns or feedback during this transition to KPL, and we all want to be receptive to what they are needing during this time. People's concerns and needs vary a lot during this time, and that can be very difficult navigating, as well as your own and your organization. So please reach out to us if you need some support. This is something that should be going on regardless if there's a pandemic or not. Continuous participant input is a really important and valued element of KPL. So this is just a reminder to keep doing what you're doing. And before we have Yolanda deliver her content on COVID-19, just to segue into that, we do want to encourage you all as facilitators who are resources for participants in KPL to inform yourself about COVID, and also provide resources to participants, which you have already been doing about COVID-19, the symptoms, healthy habits, and so on. We have a link here to the CDC's website to learn more about COVID-19, but also Yolanda is going to spend some time talking about some information and childcare early learning background. We think she'd be a great fit for this. So Yolanda, Nicole's going to switch over to your slide deck right now, and then once that is up and running, you are welcome to start whenever you'd like.
Great, thank you. Okay, so this is just about basics of COVID, and if you have questions and want to get into more detail, I'm more than happy to answer questions. But this is really just designed to give you some really need to know information and the necessary guidance, you know, for you to, so you can create a healthy play space each week. And so it actually sounds like this will be a review for many of you. So next slide. So just very briefly, so we've all heard about novel coronavirus, and it's officially called SARS-CoV-2. And it is novel because scientists have never seen this type of coronavirus before. That being said, you know, we're familiar with many other types of coronaviruses because many of the common colds that we do get are caused by another form of coronavirus. But at this point, we don't know really relatively anything about this particular one. However, we do know that it is very contagious, and it is now, I guess, seen pretty much in every country in the world. And that the illness that this novel coronavirus causes is called the COVID-19. So next slide. So let's quickly review the symptoms because, you know, when we first started hearing about COVID-19, there were really only 3 symptoms. It was, you know, fever, cough, and difficulty breathing. And now, over the last few months, this list has definitely expanded, and children and adults can get any of these symptoms, any combination of symptoms, or none at all. And they can be asymptomatic and still test positive. So you also still want to look for fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. So yeah, so that's the current list. Next slide. So how does this spread? So we all have a general idea of how it spreads, and it is through the larger respiratory droplets when an infected person coughs or sneezes. Another way is if you touch an object with the virus and then touch your mouth, your nose, or even your eyes. However, this is not the primary way that you can get infected with the virus. And the last way is the virus is thought to spread is through prolonged close contact with another individual who does have the virus. So close contact is defined as being within 6 feet of someone else for at least 15 minutes. Now, that being said, you know, it is also believed that the virus is shed through small respiratory droplets as well that are normally released when we're just simply talking or speaking. And this is really something to be aware of, you know, when you're in a large group and you're talking to people and you're just, you know, close to one another for longer periods of time. Being outdoors can slow the spread because people are more likely to have more room to spread out, and the virus has more space and it can become more diluted. So that being said, you know, if you can spend the time outdoors, do so. It is the best for everybody. So if I've heard that some people are spending some time outdoors with their play groups, and that is pretty much the best thing you can do right now. Next slide. So, so let's see. So helping to prevent the spread of the virus, to keep you healthy, your family healthy, the kids you work with healthy. There are definitely numerous ways, and since we don't have a vaccine as yet, everybody does have to play an active role in trying to prevent the spread. So I talked a little bit about physical distancing. That 6 feet between you and others, you know, really goes a long way, actually. And, you know, while you're with the children and the parents, you know, really try to keep that distance between the groups. So, you know, and I recognize, you know, and I work on child care health team and recognize that this is very, very difficult with young children. So, you know, we just ask that you do your best. You might want to set up just, you know, family groups separate. And you'll have the parents help out, and I'm assuming you do anyway. You know, try to, you know, no more than the 15 minutes or preferably less, that kids are even coming close to each other. You know, if, you know, try to set up maybe, and I don't know how you set up your sites, but, you know, you might, if you have, you know, the toys up like 6 feet apart, so that you know, little groups are separated. You know, you can have group games or even reading, you know, reading stories, but just have everybody just spread out, obviously. So, so you can still do a lot of what you want to do, but only just, you know, need a larger space and just spread out, and preferably outside. Also, frequent hand washing is a significant way to prevent the unnecessary spread of this virus. I'll talk a little bit more about that, I think a slide or two from now. I'd say it's also important for you to cover your coughs and sneezes with a tissue, or, you know, inside your elbow. And then if you do use a tissue, please throw it out right away and wash your hands. And then the last thing is the use of face coverings. They are actually required in this state now. While you're with people, then you can't maintain that 6 feet apart, as well as when you are inside. Cleaning toys is another thing. So we'll get a little, again, talk about that a little bit. Okay, next slide. Hand washing, you know, this should be done using the proper technique and for at least 20 seconds. If soap and water are not available, you can always use hand sanitizer with at least at 60% alcohol. But this can only be used if your hands are not visibly dirty, because the hand sanitizer just won't work effectively if you've got any kind of dirt or other debris on your hands. Just put a small amount of the gel in the palm of your hand, and I would probably just read the directions just to make sure you know, you get the right amount. And then you just really rub your hands together thoroughly, you know, top and bottom, all surfaces, until your hands are dry. And I guess theoretically it should take about 20 seconds as well. However, you cannot use hand sanitizer on children that are 2 and younger. So just be aware of that. And then, as you can see from the slide, these are all the times where you should be washing your hands. You know, when you first arrive at the play space, if you eat there, I don't know if you do, but before and after, or after using the restroom, or coughing or sneezing. After handling your cloth face covering, because it could have the virus on the cover, so you want to wash your hands there. If you really do need to touch your face, please wash your hands first. And then, of course, whenever you leave a public space, wash your hands. Or again, use hand sanitizer if that's the only thing available. And after coming in from outside, and then when you leave that place, right before you leave the play space, wash your hands. Next slide, please. So, cloth face coverings. So when you cannot maintain that 6-foot distance between others, then you need to wear a cloth face covering. This goes for any time that you are indoors, especially indoors, and then outdoors in a public space if you can't maintain that 6 feet. Again, this is mandated, 5 years and older. Everybody 5 years and older has to wear a face mask or cloth face covering. And, you know, we just recommend the cloth face coverings as opposed to the medical masks or the N95s, because those two are really just, we need to conserve those for the healthcare workers. Now, you do not need to wear a face covering if you are at home alone or with those that you normally share a home. Also, again, as I said, you don't have to wear it outside if you're farther, if you're not within 6 feet of anybody else. So that's it on that. So next slide, please. So cleaning toys. So yeah, if you have infants or very young children that still like to put toys in their mouth, that can happen, but please be very diligent about once those toys are put down, you take them up right away, put them in a bin or a bag or something so that you can, they can be washed later. So you certainly don't want another child to get a hold of that toy that's been in someone else's mouth. You can sanitize toys by hand using a bleach solution or an EPA approved product that kills the coronavirus. The dishwasher can sanitize toys. And even, for those softer toys, you can put them in the washing machine. One thing is we don't recommend the wooden toys, like raw wood toys, because they just cannot be cleaned appropriately. So everything else, if all the other wooden toys are fine, if it's got that kind of a coating on it or a kind of a sheen to it, then that can be cleaned, but no raw wood. Next slide, please.
Yolanda, we have a couple of questions in the chat room. So someone said, what about physical barriers? If you're within 6 feet, does that help?
Physical barriers, you mean like if you kind of like cut part of the room off from it, so you have like little, I guess it depends on how high that physical barrier is. I mean, if you've just got, I mean, I guess it just depends on how high those are. If they're very short and you're just kind of cordoning off a bit of a room or a space so that, like one family can play in one area and another family can play in another area, that's great. But if those barriers are very low, and if you're still within 6 feet, that you need to, like wear a mask or, yeah, that's it. If it's high enough, then that's okay. But I'm not quite sure. I can't, if you want to describe the place for me or the configuration you're thinking of, then I can speak to that.
We also have another question. And Sam, if that doesn't answer your question, please feel free to chime in the chat box if you have another question or want to elaborate. We do have another question, and someone wants to know, why can't you use hand sanitizer on children 2 and younger? They're just curious.
Oh, why you can't? Because they're more apt to put their fingers in their mouth. And we don't want them to absorb any of that, get any of that alcohol. That's pretty strong alcohol that's in the hand sanitizer. So we don't want any, 2 years and younger, as I said, more apt to put their fingers in their mouth. So that's why.
Thank you, Yolanda. Does anyone else have any questions before we move on to the next slide? Okay.
Cleaning for the wooden toys, is that still good to clean? I mean, is the wooden toys still good for the kid to play, or is not good for them to play because we cannot clean really thoroughly for the wooden toys?
Well, yeah, I'm not very clear on how you, I mean, are you able to take, I guess taking toy, do you take toys back with you and clean them? Or I guess I don't know if all the play groups have different situations, but yeah, toys, are you just asking like how, if you can't clean a toy, can you, I'm sorry, maybe ask the question again.
I was asking about the wooden toys. So if we like use soap and water, sprayed it, and then clean it, then we use clear water, wash it, then we use dilute bleach to sterilize it. Is it still good?
Is that on raw wood? Raw wood? Because there are a lot of wooden toys that are kind of coated with I don't know what it is. It just makes them kind of shiny, or not even shiny, but you could tell they've either been painted or there's some thin layer of coating of some sort on it, so that it's just not.
Oh, so you're only talking about the rough, like the rough, like not like the rough wooden toys, right? You're not talking about the one already polished.
Right. Yes, the polished ones you can use because those can be cleaned. But it's just the ones that are just the raw wood, like they're just, nothing's on it. You know, nothing, no coating or anything is on the toy. It's not painted, it's not shellacked or whatever. Those don't use because they really just cannot be cleaned very well. But any of the other wooden types of toys, like there's wooden puzzles, for example, you know, that's got that kind of a thin coating. I don't know what they put on there, but you know, most of the wooden toys that I've seen in childcare settings are coated with something. It's not just that raw wood, and those are absolutely fine to use.
Okay, got it. Thank you.
Does that answer your question?
Yes, thanks.
Okay, sure.
We also have another question, Yolanda. Someone wants to know if eyewear is helpful, face shields, plexiglass shields.
Well, so as far as a face shield, you can use them. They're not, I would use them in certain circumstances if you cannot tolerate a mask. I know that we're going to, for the childcare settings, I believe that the face shields would be okay, especially for little younger kids that cannot wear the masks, or they can't keep them on properly, or you know, they just don't like to have it on. If you have a face shield, though, it really needs to like hug the forehead, come all the way around towards the ears, and then down below the chin. Again, the masks are the best thing, but understanding that, some people cannot tolerate the face masks, and some cannot even wear the face mask. There are some people, like if you have difficulty breathing with them, or you're unable to take the face mask off by yourself. If you have asthma, and as I said, like if it's difficult to breathe with that face mask on, then you know, you shouldn't be wearing that. But a face shield would be appropriate if it you know, as I said, it kind of hugs the forehead and things like that. So, and children can wear, they do have children's face masks, or those shields as well. Plexiglass, I'm not, that's thick, so I don't know if, are you thinking of that as a barrier between people? You wouldn't put, plexiglass is a thicker thing. I think I've never seen them made with plexiglass, if that's what you're referring to for the masks or the shields, face shields. I hope that answers questions. If not, I will certainly answer any others.
Thank you, Yolanda.
Sure. Okay, so health screening. So some sort of health screening is recommended prior to children entering that play space. So it's recommended that a temperature be taken, or by you know, or like when the child actually gets to the play space, or you know, the temperature can be taken at home by the parent, and the parent just tells you, oh, it was, you know, 98.6, you know, et cetera. And then you consider asking certain questions about any new symptoms, and I stress new, okay? So for example, someone has had allergies for quite a few weeks and still has a congestion or runny nose from the allergies, then that's, even though those are symptoms of COVID, those have been going on for quite a while. We know the child has allergies, for example, and those wouldn't be of concern. So we're looking only at new symptoms. And so, you know, you want to ask them about any of those new symptoms, you know, such as what we went over before, like the fever, cough, sore throat, congested headache, you know, vomiting, diarrhea in the last day or so. And so, yeah, so really anything that is new that's been happening within, well, technically the last 14 days. Because that up to 14 days is your, is the virus can take hold. It takes up to 2 to 14 days. So that's called your incubation period. People can be contagious 48 hours prior to showing symptoms. Let's see. So anyway, so we you know, I highly suggest at least doing the temperature and then asking those questions. And granted, some people can very well be asymptomatic and positive. And that's, so with that, you want to maybe you consider asking families if they've had, if they have family members that have been sick. You know, so let's say a sibling's or a child's older sibling has been sick and they live in the same household. So you want to ask about household members as well when you ask your questions. Because then that would mean that that child that's entering your play space is has been exposed to the virus, potentially exposed to the virus. Okay, and last slide, please. So lastly, just want to go over COVID testing sites. So get a test if you feel that you've been exposed. They're fairly readily available now. I would first try your pediatrician or your medical provider, but there are a variety. There's a long list of free and open access COVID testing sites in the Puget Sound area. And I believe that list is on our website, but I can certainly pass that along if need be. And you know, sites include like City of Seattle, King County Public Health, Health Point, Neighbor Care, CMAR. Everybody has a variety of clinics that are open for these this testing. However, I will tell you that most of them do require prearranged appointments. So pretty easy to get. There are some rapid testing sites, I believe. Kids only be tested by children's. Are you saying that children can only be tested at Children's Hospital? I just saw it. That is not true. There's a lot of places that will test children, so I'm not quite sure where you got that information, if I'm reading it correctly. So please correct me if I misunderstood your comment there. But yeah, so that's it for my part. I know it's very basic information. As I said, most of you probably are familiar with much of this, but it's always good to hear it more than once. So yeah, if there's any other questions, I'll be happy to answer them.
Thank you, Yolanda. That was really useful, in my opinion. It was really good information. I think it was
You're welcome.
relevant to what people need to hear right now.
Yeah.
And there aren't any more questions. I think we'll move along. But of course, if someone has a question for Yolanda as we wrap up, please chime in. Oh, it looks like in regards to the children being tested. Someone has all public places only test if you're 18 and older.
I don't think that that's, I know because I just passed that situation. Well, that's interesting because I have never heard that before. I also, part of my, I split some, now that we're in this COVID crisis thing, I split my time between the child care health team, which is my primary job, but I also man the, take all the calls that come into the King County COVID hotline, and any call that's from a provider or has anything to do with a daycare, that I talk to the providers. And I never heard that. I've heard that people going to other, it's not just like children. So I've never heard that. So I don't know. I guess I can't speak to that. Not sure.
Does it maybe depend on the location and entity providing the testing, whether or not
maybe. I mean, we suggest, of course, we always tell people to try your pediatrician first. Mm-hmm. If that doesn't work, then we tell them about all the COVID, the free access sites that people can get into. And I've never heard once that, the only thing I actually ever heard with regard to that is Evergreen Hospital said that they don't test children under 10. But other than that, and that was a surprise to myself and my entire team. So yeah, I don't know. I can't speak to that because I've never before.
So maybe folks who are seeking out testing, that's something that they could ask as they're making appointments to get tested, just to clarify. Maybe that might be worthwhile.
Yeah, all the public places only tested if you are 18 or older. Wow, if that is really true, again, I've not heard that, but I think I'm going to check into that because we've never heard otherwise. I'm just trying to look at some of these comments here. I think we addressed most of them, I think, or all of them.
Yeah, I think we got to all of them.
Yeah. Yeah, well, yeah, I think I'm gonna check into that
okay.
Comment about the 18 or it won't take anybody younger than 18 because that's a new one. But might be right. Right. So,
and we can update all of you too if we find out more information related to that.
Yeah. I will check into that though.
Thank you.
Sure.
All right. Well, again, thank you, Yolanda. And we will continue the conversation. So we just had a few more items just to consider as we're thinking about going back to in-person. And one of them is posting some information at the entrances and exits of your KPL setting related to symptoms and asking folks to not attend if they have these symptoms. And this is on the next slide. So this is just something that you often see in public spaces. Like if you see a restaurant or a building, they'll often have kind of that general information at the exit and entrances to remind people to have a face covering or to not come in if they are experiencing symptoms and so on. So that's something that you can also have written or deliver verbally as well in your group. And on the next slide, I won't spend too much time on this because Yolanda actually did a really nice job talking about this, about setting up this space to accommodate for distancing as best as you can, which is very difficult. We realize with little ones that the reality is that it can be very difficult to distance while children are playing, especially if they're very young. But as a facilitator, just do the best that you can do to set up the space to accommodate for that. And with caregiver support and help, hopefully people can, to some extent, distance safely during the KPL session. And then, of course, with the children, as you can, just continue to have conversations with them about why we need to distance and why we need to do that even in the KPL setting to keep everyone happy and healthy and safe. And on this next slide, we just want to kind of open the space to talk about your ideas and thoughts and concerns about how activities may look during a group that has recently transitioned back to in-person, and how you may adapt activities that you typically do to help promote distancing or to help reduce the spread of COVID-19. I don't know if any of you have thought about this yet, but it's definitely something to consider as you're thinking about transitioning back to in-person KPL. Does anyone have any like thoughts or ideas related to this? It's okay if not. Some ideas that the team here at Child Care Resources kind of brainstormed is to emphasize activities that don't rely on physical interaction, so with another person. So for example, like singing, different types of music, maybe like movement activities that an individual can enjoy, like dancing, as well as some have mentioned, outside activities, being out in the open air is definitely helpful and helps reduce the spread. And either having some activities outside or having the entire group outside is something that you can consider as well. As well as using sensory tables to soap and water and washing toys. That's also another activity idea. So just something to keep in mind because you may need to refine some of the activities that you offer during your KPL group when you do go back to in-person. And on the next slide, it was a while back, but one of the facilitators had asked for us to discuss how we continue to build community in a KPL group that's distancing. So on the next slide, we have posed that question.
Kim, real quick, we had a comment.
Oh, sure, yeah.
Someone was asking if you don't think a sensory table would spread virus. I'm also kind of wondering if, Yolanda, about water, if it is safe to share water, like in a sensory table, if that's safe.
Yeah.
What if it's like soapy water too?
Yeah.
At this point, we are not recommending the sensory tables.
Okay.
Because they are often shared. You cannot clean the sand if you put sand in there. Water, yeah, we're kind of nixing that one. You know, it's not recommended. Now, if there's a possibility of individual things, I know
okay.
providers and, you know, like if you get like one of those, a dish pan, you know, those like dish pan thing, you know.
Yeah.
Thing, and you can put some water or sand in there, and it's all individual. So the toys are in there as well. Then, and that's just for that one child. And then if you at the end, you know, you just dump everything out and you sanitize the tub and the toys. So if it's individual play in an sensory thing, you know, table. Bucket, whatever, then that's fine, but no shared play.
Okay, thank you for that clarification. Yeah, I know there are a lot of groups that have like little individual plastic tubs that are smaller, kind of like big Tupperwares or like little bins and whatnot. So that's good to know that those folks will continue to use that if they wish to do so.
Yeah, and just make sure that the sand, like if you use sand as opposed to water, because I know some people like the sand, then that's got to just be thrown out.
Yeah.
In the end, it's not safe or anything like that. Yeah.
Thank you. Such good information. Does anyone else have ideas related to this or concerns about adapting activities so that they're safer? Okay. Well, so just for the next point, we just wanted, again, to bring this up because our facilitator raised this question a while back about building community during a KPL that is distancing. And any thoughts you have on this are welcomed. But I would say that in general, always promoting caregivers to build community, promoting spaces where caregivers can build community is a very typical thing in general in KPL, and all the ways that you do that can actually be still relevant during this time, even with physical distancing. So providing opportunities for caregivers, for example, to have a snack with their children, they can bring their own snacks, having a question of the day for them to use as a conversation starter amongst themselves. And things like that can still be done even when participants are physically distancing. It looks like there are a couple more comments coming in.
Yeah, we had some saying that they are thinking of circle games as picnic groupings / caregiver groupings instead of one big one. Suseta mentioned this summer they're cooking classes via Zoom since they're at home. Kids and moms are loving it. It's simple, like cookies, making popsicles, 1 month cake, and etc. And Sue added, kind of like each group is a petal of a daisy and the facilitator is in the middle.
Oh, that's cute. That's right. I like that idea. Yeah, so there are a lot of creative ways to emotionally bring people together, even though we're physically distancing. So if you are needing some ideas on this topic more after this webinar, please let us know and we can continue to brainstorm with all of you. And one of the last items we wanted to talk about, which is on the next slide, is monitoring group size. So many groups actually do this already in general because the location that they host to a KPL group in has a maximum capacity. This is something that you may consider to do now if you haven't before, to stay in alignment with local and state mandates and recommendations on group gatherings. So as you're transitioning to in-person, have these conversations with your team and your supervisor about what is your maximum number that is aligned with local recommendations and mandates, as well as with the space that you are hosting your KPL group in, which may belong to someone else, as well as your comfort level facilitating and being in that environment. So those are all things to think about. And once you have that number, it's, I think, easier and more clear to manage the group when you do start going back to in-person. And then just lastly, to wrap up this little section, on the next slide, we just want to remind you that eventually when you all do return to in-person, that's going to be a very exciting time for participants to connect and see each other again. And so we encourage you to frame it as a fun reunion and celebration focused on seeing friends again and coming together as a community.
Can I just, this is Yolanda, can I just say one thing here?
Yes, Yolanda, we would love to get your insight.
So this is pretty much what I do when I'm on my other job, so to speak. And you know, the first thing, if a family comes to you and says someone has tested or certainly tested positive, then you need to then King County needs to be notified. So the first thing would be like to call our COVID hotline and report it. Report that one of your either one of the kids or a family member, like a parent, has tested positive. Then that comes to me, for example, and then we take it from there. But so you would want to contact King County and their COVID hotline. I think that's just on the website. Then you want to tell all the other families that have been in contact with this caregiver, so let's say it was a mom that was tested positive, and if that mom was in with the child during that play time, I mean, a lot of this has to do with dates and when people in your play space were potentially exposed. Okay, so I don't, depends, like if you meet once a week, there might be a chance that there's no exposure because it depends on when symptoms arise. So, so for example, mom calls in and says, oh, I'm not going to bring my daughter today because I'm not feeling very well, or rather I'm not feeling very well, or I just tested positive for COVID and I'm keeping my child home. Child, of course, needs to stay home for 14 days because that's the incubation. So they can't, that child cannot return for 2 weeks to your group. But it also has to do with contagiousness. So someone's contagious 48 hours prior to having symptoms. So if it's been a week since the parent or the child was at your play area, then there's no exposure. And then you really wouldn't have to say anything to the other families that are normally in that play group. So again, you want to always ask, you know, when did you start having symptoms? If the person's asymptomatic and they tested, then you're looking at the date that they got tested, and you're the same thing as if that was the date of their first symptoms. Kind of gets a little complicated, but and then so you really want it. So if you meet once a week, you know, chances are could be pretty good that there was really no exposure to begin with.
And Yolanda, I have a question. If many of the people that are on this call are not King County residents, so every county has
yes
this hotline. Do you know? Okay.
Yeah. So okay, I wasn't aware of that. So yeah. That's for King County.
Okay.
Here, Snohomish might have something different. Yeah.
Okay.
Clarifying that.
And Yolanda, I have a question also regarding privacy of patient or someone that was tested positive. What can you say about that?
Yeah, you basically have to leave all private information. So you can just say you were potentially exposed. You don't want to say that it's a parent. You don't want to say it's a child. You just want to say you were potentially exposed the last time you were here at my play space. So for example, if you met on a Wednesday and everything was fine, all parents, children, no problems. And then the next day, the parent, you know, says, oh, I'm not feeling, you know, calls you and says, I just want to let you know, I know we were there yesterday and now I'm not feeling well and my child isn't feeling well either, you know. Then you've got an exposure because they were there 48 hours, you know, less than 48 hours prior to the symptoms. So in a case like that, you're going to say, well, you know, I really think you know, please get tested as soon as possible, because given that we've got, given the situation and given that so many of these, I mean, all these COVID symptoms are really can be, you know, for so many other types of illnesses, but we need to be very, very careful, of course. So so you would want to warn your other families and just say there was potential exposure and that they need to really look out, be more diligent in looking, you know, being aware of some new symptoms in themselves and their children. If that test comes back negative, then everything's fine. Everybody can, you know, come back the next week or whatever. If it was positive, then everybody was exposed who was there that 1 week that the parent and the child were there. Does that Does that make that clear? Or it can get a little messy. You know, there's so many scenarios, but primarily, you know, the main thing is to contact King County and to, you know, tell families, but really, and also find out the dates that these, either the child or the parent was having symptoms. And if no symptoms, when did they get tested? And then you can figure out whether there was a potential exposure or not. And then at that point, you can call family. You know, you can tell families that there was exposure. But you don't want to necessarily do it needlessly if you meet like once a week. I don't know how often your groups meet. Is it once a week or?
Once a week, yeah. This phone number is now, thank you, Kim. This phone number is now in the chat. So you can save it. Hopefully you're not gonna use it. We are almost at 2:30. So I think we're gonna skip the next two slides. Nicole or Kim, do you wanna take it from here?
Sure. We wanted to go over some resources real quickly. And so right here we have some links to King County Public Health's recommendation on cleaning toys, also available in Spanish. Changes to cleaning and disinfecting during COVID-19, and CDC supplemental guide for childcare. We also have a webinar. We have the COVID-19 hand washing edition. So just as a reminder, the link is here and can also be found on our YouTube channel. And we just really encourage fun activities for washing hands, singing songs, doing music, making it something fun. We also have these two resources on face coverings on children, and also on the next one we have information on helping children to wear face coverings. And then on the last link we have is a social distancing in early care and education webinar recording. And so these will all be available. I will send these slides with a follow-up email. The next thing is just our resources for activities. We're going to be highlighting boards that we have on Pinterest. And this week we're doing Let's Move board, or this webinar recording. And so please click this link and you'll be taken to our Pinterest page where you can explore many other boards that we have that we're still adding things to. And I'm going to send it to Zainab to wrap it up.
Okay, we have resources here on our website that you can access for Kaleidoscope and learn resources and other COVID-related updates. On the next slide, we have the link for the next, our first monthly convo, which will on August 4th, and KPL list. And any final questions or comments, please let us know in the chat. And lastly, on the next slide, we have quick chat bomb question. What is one thing keeping you cool this summer? If you want to just type that in the chat. Have ice cream, watermelon, margaritas, popsicles, ice water, kayaking, lakes, and sea, swimming. Yeah, just have all the sources used in our webinar. And just want to thank all of you for attending this webinar with us. And thank you, Yolanda, for all of those helpful information.
Very welcome.
Thank you, Yolanda, again, and thank you everyone for joining us.
Thank you.
Welcome.
Thank you.